Hello everyone, welcome back to Scan360, your learning hub for radiology, diagnostic imaging, chest X-ray interpretation and important radiological science for residents and doctors. In today's video, we are discussing one of the most important and frequently asked radiological signs in chest imaging, the cervicothoracic sign. This sign is extremely useful in chest X-ray interpretation, especially for localization of mediastinal masses on plain radiographs. If you are a radiology resident, medical student, FCPS trainee, MD Radiology candidate, or preparing for Viva examination, this is a must-know topic because the cervicothoracic sign is commonly asked in radiology exams and clinical discussions. So first, what is the cervicothoracic sign? The cervicothoracic sign helps determine whether an upper mediastinal opacity lies in the anterior mediastinum or the posterior mediastinum on a frontal chest X-ray. The principle is simple but extremely important. The anterior mediastinum ends at the level of the clavicle, while the posterior mediastinum extends above the clavicle into the neck. Therefore, if the upper border of a mediastinal mass is clearly visible above the clavicle, the lesion is likely located in the posterior mediastinum. On the other hand, if the upper margin of the opacity becomes indistinct or it disappears at the clavicular level, the mass is usually in the anterior mediastinum. This happens because posterior lung apices provide contrast behind the posterior mediastinal lesions, allowing their margins to remain visible. Anterior lesions lose their silhouette against the soft tissue of neck. This sign is extremely useful for differential diagnosis of mediastinal masses and appears frequently in FRCR, FCPS radiology, MD Radiology, and Radiology Viva exams. Common causes of posterior mediastinal masses include neurogenic tumor, schwannoma, neuroblastoma, paravertebral abscess, extramedullary hematopoiesis. Common anterior mediastinal masses include thymoma, thyroid mass, teratoma, lymphoma. This sign is also important in routine reporting of chest radiographs, mediastinal widening, superior mediastinal masses, thoracic imaging, diagnostic radiology cases. For beginners in radiology, understanding the cervicothoracic sign improves confidence in chest X-ray localization and helps in accurate anatomical diagnosis. If you enjoy radiology education, chest imaging tutorials, radiological science, CT scan interpretation, MRI basics, and exam-oriented radiology learning, then make sure to subscribe to Scan360 and turn on notifications. Thank you very much.